novel nitric oxide nasal spray, a randomized trial. So let's see, they're looking at outpatient therapies, which are readily accessible, will be essentially, so this is a background. So they're saying that the reason that they're doing this is because outpatient therapies, which are rarely accessible, will be essential to reduce COVID illness progression in high-risk individuals. So starting off with the questionable statement, because COVID can infect everyone, not just high-risk individuals. And this is especially so as the virus continues to mutate with greater transmissibility despite increased global vaccination. We don't have great vaccination rates either, so little misleading to start off. Alright, so for their methods, they are looking at a randomized... Oh, you guys are super low. There we go. Alright, so they're doing a randomized double-blind multi-center parallel group placebo control. So that's a good way to do something. Make that yellow. They're looking at adults 18 to 70 years with mild COVID. And this is confirmed by PCR. Through a nasal swab. And the rates that they did it was they did self-administration of the nasal oxide or nitric oxide spray, the nasal spray, 6 times a day, 2 sprays per nostril at a 0.45 milliliters of solution per dose. And that's every day of the week for 7 days. And they're showing that overall the average COVID RNA levels were comparable at baseline, so that's not great. Oh, at baseline, sorry, so that's good. So that means that at before treatment, at they both groups had similar viral loads, so that's not going to be something that influences the findings or would influence the results. With the first endpoint showing a change from baseline to end of treatment. So the treatment would be over the course of a week was approximately 0.52 copies per milliliter. That doesn't really give me anything without the original context, so I'm not going to highlight that. Secondary endpoint assessments demonstrated a greater proportion of patients receiving this nasal spray cleared COVID were PCR negative by the end of treatment compared to placebo. So, but the p-value is kind of weak. It's 0.044, barely significant. So it looks like they clear 20%, about, we'll say 15% of patients cleared COVID faster when being treated with a nasal spray. Which is interesting. That might imply that you're sort of reinfecting yourself through this nasal mucus production of COVID. That might be an implication. And sorry, I gotta resave in my papers to read file. Alright, so the research and context. Just see if I missed any comments. we're good. So the research in context is that prior to the study, evidence from several sources have recognized the antiviral effect of nitric oxide, but there's been minimal clinical research exploring the impact of this on COVID infections, which I stated in the first article we read on this earlier today. Next, nitric oxide spray was administered 6 times daily for 7 days. So, yep, it was 1 week. I was right about that. And it was efficacious in accelerating the reduction of COVID from the nasal cavity. So that's the sort of the thing is like, okay, so it's reducing it from the nasal cavity, but what about your throat? What about your oral transmission? That would be something I would be interested in also seeing. So I'm just going to highlight this in red because, okay, so you're reducing it in one location, but people talk out of their mouths, not their nose. So are you also reducing it there? Probably not. And then they're saying that using this could accelerate the reduction of COVID from the nasal cavity, and the implications include decreasing the duration of COVID infectivity, possibly reducing hospital admissions, diminishing disease severity, and disease transmission. So that's a lot of big statements. Let's go through their article and see what they got. So I'm going to do a quick Control S. So this is a phase 2 clinical trial. They're doing a small volume nitric oxide spray at 0.5 milliliters per dose. And the full bottle is 25 milliliter spray, so you can calculate how many doses are actually in the bottle if you're interested. So 1/2, so there's like 50 sprays about. So let's see, would that last a week? So they're doing 2 sprays a day. No, they're doing 6 sprays a day, 2 in each nostril. That's 4 times 6. That's 24. So they'd have to go through several bottles within the study. So that's a high usage rate. See if I missed any comments. Did not. Okay, so laboratory investigations have demonstrated immediate ferricidal action of nitric oxide against all volatile organic compounds. That's what VOCs stand for COVID and other respiratory pathogens. Mechanistically, nitric oxide, nitric oxide, immediately alters the structural integrity of viral proteins through nitrosylation and palmitoylation. So I'm going to highlight that. I'll have to look up what those are. It interferes with the fusion of the spike protein to its cognitive host receptor, converting ACE2 enzyme. So that's interesting, green. And it impedes protease activity, resulting in inhibition of viral replication. So those are the 2 methods that they think that it impacts COVID, is by interfering with the fusion of the spike protein, and then also impeding, or ergo impeding, viral protease activity. No, different thing, not ergo. So also impeding viral protease activity. Here they're presenting the phase 3 randomized double-blind placebo-controlled trial in non-hospitalized patients with mild COVID. Thank you for the rows. The primary outcome measures of nasal COVID RNA acceleration clearance was used to assess the efficacy of this transformational nitric oxide spray in high-risk patients. So that's also a point. So like they're looking at just mild COVID. So in theory, well, let's think about this in the theory side. So if you have a high level of COVID, if you have severe COVID compared to mild COVID, you're going to be producing more virions, more particles of COVID at the severe level than you are at the mild level. So that begs the question, all right, so would this also work effectively for people that have more severe forms of COVID or have higher viral loads, higher virus levels of COVID in their system, and therefore being produced in their nasal cavities? Is there going to be the same effect, or as significant effect? Would you need more doses at these higher levels? Would it still be effective? That's something that the study does not consider because they're only looking at mild patients. So that's something that you would have to think about and do a follow-up study in. So that's a big limitation of this study itself. Reminder to drink water. So this is a multi-center double-blind parallel group efficacy and safety study. Fancy words, just a way that they're doing it. So that's a highly controlled study. That's essentially all that means. Self-administration. So that's another thing, self-administration. So are they administering it correctly? Were they trained to do this? Are they people with experience in doing nasal sprays? Are they like sticking it deep enough in their nose? Is there going to be a level of user error? That's something that would also need to be considered. And it looks like they all also received additional treatments, so those could be confounding variables. They got antipyretics for the treatment of fever and pain, antitussives for cough, and adequate hydration nutrition. So these could be factors that are at play. And let me just double check that I haven't missed any comments. Nope, I'm good. So those could be other confounding variables. So maybe that's, I don't think they would be because this is a direct nasal spray. If there were other effects on these other things, we would probably have seen it at this point, 4 years in. So it's just something to be mindful of. It's not really saying, oh, well, this is something, so don't consider the nasal spray. No. Okay, so trials at 20 clinical sites across India. There were 15 sites enrolled. This is looking at patients from August 2021 to January 2025. And that's cool. A low incidence of COVID infections and other priorities. Oh, so there were other studies at the institution, so they didn't have enough patients to recruit from those other 5 sites. So eligible adult men and women, so this is not applicable to children or anyone under the age of 18. Double check, no comments. Gucci. Okay, so that's something to know. Do a quick control save. Oops, sorry. My little stand slowly shifts over time, or maybe I'm just hitting it. I don't know. So, regarding the list of vaccination status, mild symptoms of COVID included fever, cough, sore throat, malaise, headache, nasal congestion, muscle pain, gastrointestinal symptoms, lack of smell without shortness of breath or dyspnea. And then blood oxygen saturation was greater than 94%, so they're not having breathing difficulties or severe breathing difficulties at least, and that's shown by the respiration rate, which is within normal, so less than 24 breaths per minute, so they're not struggling to breathe, even though they... Oh, without, yeah, okay, so we're good. For women to be enrolled, evidence of postmenopausal or negative pre-treatment urinary was required. Oh, that's weird. So even though they're enrolling between 18 and 70 years of age, women can only be enrolled in the study that were premenopausal, so they have only younger women in the study. So they wouldn't have older women. There were 306 eligible participants, and they were split in a 1-to-1 ratio. Oh, they were given instructions on how to self-administer each dose, so that's good. And they have a control. They have a nasal spray and a placebo bottle. That's something you like to see. And they kept the bottle shape, size, and appearance the same between the two, and the smell and taste the same between the two, so people can't tell if they are in the placebo and control, if they have friends that are also in the study. So that is a good job. And they're recording their drug compliance, so making sure that they're taking it at the appropriate intervals that they said they would. Sorry, that should be yellow, not green. It's not interesting, it's just, that's what it is. They're looking at day 2, which is less than 24 hours after treatment, day 4, 72 hours after treatment, and day 8, 7 days after treatment, which is the end of the study, or end of time. And on day 8, they did a physical examination, ECG, and blood and urine lab evaluations. Any subjects that are COVID negative by the end of the period were withdrawn from the study. So theoretically, they might not have the same number of patients in each control group versus study group due to dropping out randomly depending on viral clearance. Let me just double check that there are no comments. Good. Control S. We have efficacy outcomes and safety outcomes. I'm just going to quickly glance through these. I don't expect anything interesting to be in them, so I don't want to waste too much time. So they are including the number and type of adverse events and serious adverse events, so that's good. So that's essentially like a complication that occurs that you wouldn't expect, or maybe one that you would expect. So like an adverse event would include like the vaccine, injection site redness and soreness. That would be an expected adverse event. A serious adverse event would be like the thrombocytopenia that happened with like the J&J vaccine and the AstraZeneca. That would be a serious adverse event. They're looking at changes from baseline and vital signs to the end of the study. They're doing a good statistical test. They're doing mixed model repeated measures test, which is very good. Sample size determination. This is a very detailed study. A lot of studies don't go into this kind of depth for their methods. And then this is a nice little note. So subjects using less than 80% of their total expected doses of the medication over the treatment period were considered non-compliant. And then were removed from the study. So the patients in this were from the Delta Omicron periods. "66 subjects, about 21%, were withdrawn from the study due to noncompliance or negative PCR results. Oh, sorry. So 66 were withdrawn from study. Oh, so this is a breakdown. So 58 was due to negative PCR too soon. 8 subjects did not complete the study. The most common reason for discontinuation was that they didn't do the correct number of doses, and then one person got pregnant. They started the treatment within 3 days of symptom onset. So we're in the results now, and so in the treatment group, the COVID viral RNA went from 7 to 6.7 to 6. In the placebo group, and in the nasal spray group, it went 7 to 6 to 5. So it's showing a slightly faster reduction in COVID viral RNA being tested from the nasal spray. But I'm also interested in, okay, so when was the sampling, the final sampling taken? Or when was the sampling taken? How long after applying the nasal spray for that day's dose? That would be a very interesting or an important question. It would be a limitation of the study, because if you take that nasal spray dose too soon to the test itself, then for that day, then it would be artificially influencing the results. So I suspect that perhaps it's not I don't know. I don't have enough information yet to make a statement. And then this is just a chart of the breakdown of subjects. We already talked about that, so we don't need to do that. This is just a breakdown of the age and the patient's different statuses. But we can read this stuff down here. Where it's saying that day 8, the average change in baseline from the log of the viral RNA through day 8 was statistically superior to the change in the placebo from mean treatment. Good p-value. And then they're repeating that secondary endpoint again, whereby day 8, again, that's a very weak p-value, 0.046, barely significant. And they're showing a 16.1% reduction in the nitric oxide treated group with the nasal spray versus the placebo treated group, where 83% of subjects became negative compared to 67% by day 8. But I guess this is a good one right here. So this is a better way to look at it. So the median time to qualitative PCR conversion from positive to negative was significantly shorter in the nasal spray treated group by 4 days compared to placebo. 3 versus 7 days, day 4 versus day 8. So that would be something that is very good, because the PCR. So that's very interesting. That does imply that part of COVID's sustained effect is from the production of the basically what we're producing in our mucous membranes is being reinfecting us in a way. Yeah, that's essentially what it is, that we're producing it, and it's like giving us small reinfection periods that's continuing to extend the duration of the illness, is what the implication of that is. Haven't looked at comments in a while, so I'll see if anyone said anything. Nope. Do. And then during an 18-day duration, a greater proportion of subjects in the nitric oxide group demonstrated clinical status improvement compared to the placebo group over the 18-day duration. In terms of symptoms, so the clinical status, that would be their symptom presentation. By day 16, 94% of those treated with the nitric oxide demonstrated improvement compared to 81% of subjects in the placebo group. So again, you might actually, by doing sustained regular treatments with the nitric oxide sprays, you might be clearing the virus faster, is what the implication is. But again, this is only for mild cases of COVID. And they didn't see, ooh, what's that? What just happened? So no nasal vasodilation symptoms and no systemic vasodilation was observed, and no significant safety issue was observed. Let's look at the tables to see if they list their safety issues. Maybe it's down here. So the symptoms for the adverse events were abdominal pain, dyslipidemia, hypertriglyceridemia, myalgia, nasal discomfort, and rash. And it looks like the most frequent adverse reactions occurred with nasal discomfort. Moving on to the discussion. And then these are adult Asian patients, non-hospitalized, even though it was wasn't this an Indian study in India? Maybe they're using the word Asian loosely. The efficacy was comparable between vaccinated and unvaccinated people, which you wouldn't really expect a difference in nasal treatment. This is just a graph of the time to quote-unquote cure, time to viral clearance by PCR between placebo and the nitric oxide spray, the placebo being the placebo being the red and the nitric oxide spray being the blue. So the blue is going up faster than the red. So the blue is clearing it slightly faster, which would be the nitric oxide. Looking at the comments. Girl, let him talk. Is there someone else that said something? I don't see anything else. And then we have what kind of questions. I'm not sure what kind of questions. I forget what I said. Let me look. Nasal vasodilation. I'm not sure what you mean by types of questions. People with nasal sprays were 35% more likely to achieve negative PCR status 4 days sooner than placebo. And I'll keep looking at the chat if you answer the what type of question. And then people are suggesting that a shorter time of elimination of viral RNA will reduce the time of potential infectivity. Yes, that's true. So the nasal sprays work rapidly within the nose to activate potential shortened duration of individual's infectivity. That's maybe true. So the big thing with this that we mentioned above is that one, you're taking a lot of doses. You're doing 6 time periods a day, 6 sprays a day, twice in each nostril. That is at regular intervals. So that's one part of this. 2, this is only looking at mild COVID infections, so it's not clear if similar effects would occur with moderate or severe disease states. So at least in mild COVID infections, we can say that yes, it seems that the nitric oxide spray will shorten the duration of the individual's infectivity, and that while doing the spray at these regular intervals, it likely would reduce virus transmissibility. You would expect that it would be sort of like you spray, it decreases, and then this increases again with mucus production. You spray, it decreases, it increases again with mucus production. As the disease state progressed, it would be basically going like this, down in a linear curve. So that is what you would expect. So I don't necessarily agree with the virus transmissibility thing, because once it wears off, whatever time period that is, if you're not spraying, if you forget a spray or something, you would still have that same level of transmissibility that you would have otherwise. So maybe not that one per se. And then this is that same data. So this is something I'll want to, what's going on? Oh, I guess this is a figure, not actual text. So this is going to be a graph I'm going to want to present whenever I do the summary of this. So this is showing at day 8. This is the placebo. This is the nasal spray. This is the percentage of people who showed improvement in clinical symptoms. So by day 8, there was a 16% change. 16% more people showed symptomatic improvement than in the placebo group. And then by day 18, so like 2.5 weeks after COVID infection, 95% of people are showing symptomatic relief, as compared to 86% in the control. And then they're doing some limitations. So they're saying that they had an insufficient sample size to compare the impact of patient symptoms resolution and hospitalizations because they have low statistical power. This is just saying they don't have enough people in the study to make any comparisons. They didn't look at death or hospitalizations. And then this is interesting. They didn't talk about this in the paper, but this is a cool thing that they did. So in this, I missed comments. Let's see. Yes, that is a lot of spray. That is a lot of spray that they have to do because we did a loose calculation and each bottle is about 50 sprays. And if you're doing 24 sprays a day, 6 times 4, because 2 in each nostril, 24. So yeah, you'd go through a bottle every like 2.2 days. So you would have gone through 1, 2, 3, like about 3, maybe 4 bottles of this spray within the 7-day period. But again, this is if it's going to help reduce your symptoms, it's going to help clear the virus faster by about 4 days. That's probably something you want to do. You wouldn't likely want to do this as like a COVID preventative measure. You would likely only want to do this as a COVID symptom reduction measure. But the interesting thing here, so this is a chart of percent of total contacts tested positive for COVID. So these are household infections. So the people that in the study that tested positive for COVID, infecting their roommates, their family members, etc. So they're looking at the percentage of contacts with symptoms. So people they infected, and people contacts with that tested positive for COVID. So the blue, again, is the placebo, the red is the control, and it's looking like 5%, 10, 2. So I'm not sure how they're stacking this. If it's just individual, if these are the same people or new people. But regardless, the point is that it looks like, I'd have to look at the statistical analysis below, but it looks like it's slightly reducing the number of the percentage of household contacts so that there is a little bit of weight to their transmissibility, but it's not, I'm guessing, it's probably not statistically significant, but we can look in a second if they ran stats on that. I'm just looking through the text to see if they referenced figure 4. You know what? I'll just do a control find. Figure 4. So yeah, it was not statistically significant. So again, I don't think this is good for transmission prevention. So I'm going to highlight that green because that's an important finding. I don't think the nasal spray is good for transmission reduction. I think what it is good for is preventing you from continually reinfecting yourself with the COVID during the COVID infection, which will reduce the number of days that you are sick with COVID by about 4 days on average. Let's see if I missed any comments. That's true. I for sure would do it if I was sick. I had an allergic reaction to Paxlovid within 6 hours. I'm sorry about your allergic reaction. And yeah, one of the things they don't like widely advertise is that people with dairy allergies can't take Paxlovid because it has lactase in it. So like this, huh?
Sorry, I need to interrupt.
What's up?
I need to go get a med for Poofy because I'm worried like he could be blocked or he's having an episode.
Yeah, so are we gonna do that before groceries?
I don't know if I can leave him, if I'm being honest. Like, I don't know if I can leave him home because I'm worried about him. I need to go drive to Davis and pick up a med.
Okay, so are you gonna take him with you?
No, I'm not bringing him to Davis. I'm giving him time and I'm gonna pick up a med, but I just ordered for him to see if it helps.
So you're not gonna go grocery shopping today, is what you're saying?
I need to get groceries. I'm just like worried about him. I don't know if you're willing to pick some stuff up for me. I don't want to leave him.
Yeah, I guess. Just send me a list or something.
Okay. Alright, I'll be back. It's like 20 minutes there, 20 minutes back.
Okay. I'll just finish this and then I'll go grocery
Will you
shopping.
wait to go grocery shopping until I come back?
Yeah, I can wait.
Okay, thank you. I put a camera on the
But yeah, in terms of the COVID, or not COVID, the Paxlovid allergy, it has lactase in it, so not everyone can take that. So this might be a good alternative for helping reduce it. It's not going to have the same effects because it's not reducing your viral load within your system. It's reducing the nasal viral load potential reinfection is what it seems like. So it's going to help, but it's not going to help as much as Paxlovid would, which is an antiviral. But yeah, it definitely seems like it's something that would help people with COVID infections. So reaction to viral RNA, prove viral. So that might be a challenge actually right here. So it looks like, let me see the previous part of the sentence. Oh, it's on antivirals. And they're saying that if they didn't use benzalkonium chloride, which data has suggested that it could have some virucidal activities, that the effects might be more pronounced in people that, like, because they have to use some sort of control, and in their placebo, I guess they learned about this after the fact, or they didn't consider it until later when they were researching, but there might be some antiviral effects from that, so maybe the control would be even longer. So like ultimately they should have had in this study not just a placebo control, but also a no treatment control, and maybe that would have been a little higher. So this effects might have been even greater than what they're showing here. But ultimately, we don't know. It could just be a nothing burger. Let me just see if there's any comments. Cuckoo. And they're saying that the good safety profile is beneficial in elderly children, immunocompromised and pregnant breastfeeding women, using the nasal spray, so it could have potential benefits for more people. That's it. So I guess we'll do a quick summary. Quick Control S. So this is a stage 3 clinical trial, very high level study. They administered 6 times a day. I'm guessing since most people are awake for about 15 hours, 6 times a day, maybe like every 2.5, 3 hours they were taking this, and they were doing 2 sprays each nostril. They had a wide range of people in the study, men and women, between 18 and 70 years of age. However, the women are going to be weighted to the younger side because they excluded postmenopausal, I don't know if it would be postmenopausal, maybe just menopausal women. And what they found was that let's go to that chart because that'll be a good one. They found that it's not the right one. We'll just use the words. They found that using the nasal spray reduced the number of RNA copies over an 8-day period faster than the placebo group using a placebo nasal spray. And that on average, the patients that were taking the nasal spray actually cleared virus detected from PCR, COVID virus detected from PCR 4 days faster than the placebo group, and this is on average 3 versus 7 days, or day 4 versus day 8. And that over the 18-day period, so this is the they were testing out to 18 days, and over that period, the placebo, the blue placebo, cleared faster than the blue nasal spray cleared faster than the red placebo. So these are people that are quote unquote cured. That's a bad word for it, but people that have cleared the virus. Percentage of people in the study. And here's that same in graph form. So by day 18, 95% of people using the nasal spray cleared the virus versus 86% using the placebo. So 95 nasal spray, or the nitric oxide nasal spray, 86 placebo. And then by day 8, there's a 16% difference with 78% of people using the nitric oxide nasal spray cleared COVID versus 62 by that time period. So it seems like it will help people clear the virus faster. It does not seem like the household transmission is not statistically significantly different with the nasal spray, the nitric oxide nasal spray versus without. So it probably doesn't do anything in terms of transmission to other people, or it does minimal, would be the nicest way to say it, minimal. Yeah, that's what we learned from the paper. Did you say that they did not study menopausal and postmenopausal women? Yes. So they excluded people that they only included people that were premenopausal for women in the study. So let me scroll up to that. So when they were going through their exclusions, like people that were pregnant, they excluded. There's one person that fell pregnant in the study, they excluded that person's data. And also for women to be enrolled, they have to be premenopausal. So they did use the word postmenopausal. So if they were postmenopausal, they were not included in the study. Cool. So that's what we learned from this paper. And I'm going to sign off. Thanks for hanging out.